Hello, welcome to my YouTube channel. My name is Elliot, and today I'll be talking about some interesting things you haven't seen at the theater or operating room. So, let's take a quick tour. So, we are going to the theater. So, at the theater, um, our theater, the one we have currently is currently not in use, and so it's a cool place. So before you enter into the theater, there are certain things you need to do. You need to wash your hands here. Okay. We call it it's a sink. Okay. Scrubbing sink. All right. So this is the entrance of the theater. Usually outside the country, their theaters are usually automatic. It uses a photoelectric effect. So the doors open, they open by itself. So yeah, welcome to the theater. So um yeah, ideally before you enter into a theater, you need to scrub up, wash your hands. You're not supposed to enter the theater without a nose mask and all. But this theater is no longer in use. So I'm just using it for a demonstration for educative purposes. And then for those who haven't seen it before, probably they would want to see it for the first time, how it goes. Okay, so these are the things. So I'll show you how it's done. So once you enter into the theater, you just, I don't know, once you enter into the theater, there are a few rules you need to obey, and there are a few things you need to do and not to do at the theater. And yeah, so basically that is it. So you have to be in your scrub wear. You don't have to wear watches like this. You have to remove them, with the exception of wedding rings on your fingers. Yeah, and then okay, currently phones are used. You use the phone in order to take pictures of maybe a surgery you have done, probably getting taking a picture of, if it's a uterine fibroid, you would want to see how it looks like. And then parents who come into the theater for maybe during CS, they want to see their baby, how their baby looks like. They usually are allowed to bring their phone in, but we try as much as possible to keep things sterile. Okay, in order to avoid bacterial infection or anything of that sort. Okay, so let's quickly. Sorry about my camera. I'm hoping to get a better one very soon. So let's take a quick look around. All right. So basically, these are some of the things here. You have the bed for the operation, and with this one, you can choose to wind it in order to, you know, bring the bed up, the theater bed up or down. You understand? This is tilting it to the, it's tilting it to the left. Watch closely. You see, you realize it is tilting the bed towards the left. Okay, if you bring it this way, the more you wind it, the more it brings it to the right. So okay, so if you want the head, this part to go up, you have to wind, keep winding. Do you see it rising? Okay, so you see the bed is now up a little. All right. You can see it coming down, right? Okay. So there are other things you can do, okay? In case you feel the bed is too, I don't know, it's down a little, you can raise the bed up, okay? You can raise the theater bed up. So just give me a moment. There's a whole lot of exercise. Just give me a moment. So if you want to raise the bed, you can use this one. Okay, you can use this one. It's more like a gear. Do you even call it like the accelerator or something like that? It looks like that, or the brake. So you just press it, and the more you press it, you see the bed will be coming up. All right, it involves a lot of work. So you remember this is for tilting the bed towards the left and right, and then this one is for pushing this one up or down. Okay, this particular one is for pushing the bed up or down. No, I mean tilting it to the top. Okay, and the down there, this particular one is for raising the bed, the whole bed up. Okay, so the more you press, the more the bed goes up. Okay, so this is the monitor. We use this one for excuse me. It is for monitoring the vitals of the patient during surgery. Okay, we want to be sure that everything is fine. So the BP during the operation, the BP, the pulse, everything will be showing on this particular machine. And so if if the patient if the patient is about to die, you'll be seeing the line, you understand, with a zigzag line. Once it goes straight, the person is dead. Okay, so, and we have this one too for suctioning. We use this one. It's a suctioning machine. It has both two bottles. Sorry, it has this and that. So we use it for suctioning blood from the operating site, and then a whole lot of stuff. So this one too is an oxygen cylinder for collection of oxygen. So you can see over here that they've indicated oxygen over here. So for patients who need oxygen, we do that. We use it on them. Okay, for patients who need oxygen, we use it. And then we have this one too, the operating light. This is very, very important because during surgical operation, sometimes it's very, very difficult to see. Okay, it's difficult to see during surgical operation. You find it difficult to see. So we have this whole thing. It's a light. Okay, so during surgical operation, you use it for, and then you can direct it towards any other angle you want. You can bring it down, you can turn it this way, you can turn it that way, you can raise it. Okay, this is the on button. You press here, it's on and off. So I'm about to turn it on so that we have a look at how it's going to be like. So can you guess the color of the lights from the operating lights? Can you guess the color? Well, let's look at it. There we go. So you see, this is how it looks like. All right. So if you think you can't see, I usually like mine down like this. Okay. So if it is CS you are doing, you do, and then you bring your light towards, you position your light appropriately for whatever surgical procedure you are doing. For those of us who don't have good eyesight, we need more light to see. And so during surgical procedures or surgical operations, we usually work, you need someone standing just opposites, and then you standing here, and then someone assisting you for the surgical operation, whilst you're also standing at the other side. Okay, and so that you work in harmony. That is the idea. So the idea is to work in harmony, and then trust me, it's not easy doing this. And the nurse will also be at the foot end of the bed to also hand over any sort of surgical tool you may need for the operation to be done. Okay, so these are some of the things. These are some of the interesting things you probably haven't come across. It's an old theater, but it's a very cool place. So this is how it looks like. Okay, this is how it looks like. All right, and you need an AC, of course, because the place gets very, very, very hot sometimes when you don't turn the AC. All right, so these are some of the things. So I'll show you what you need to do, how you need to dress when you're about to assist for a surgery to be done, or when you're about to perform a surgery. All right, so just give me a moment. I'll get back to you. All right, so I'm back again. This is Elliot coming at you once again. So basically, this is how you're supposed to look, okay, during surgical operation. You see my hair is supposed to be covered nicely and neatly. So this is supposed to be a sterile one. And then my spectacle has to be also neat and clean. And then you need to cover your mouth and then nose in order to avoid contaminating the surgical area whilst communicating. Okay, and you need to wear this, you see. So with this glove, we don't use the normal glove, we use the surgical glove. We have a special glove for surgery, and so this is how it looks like. So sorry, latex. Okay, hi. Oh, I don't know how to make you see it. Okay, those for those who would like to, who would want to see, they may have to read it backwards, or you can just attach a mirror to this and it has laterally inverted the writings, so you can see latex surgical gloves. So this is how it looks like. So it's not a normal glove. This one is a surgical one. It's a sterile one. Sterile means it's clean and has no microorganisms around. So basically, this is how it looks like. How do you see me? I know I look scary in a way. So I've come to the end of this video. I hope it's a cool one. We are trying to just enjoy the whole thing. And if you have any question, you can leave it in the comments section below so that we can interact. If I have anything I would want to share with you, I'll also leave it there, and then we can share ideas. Okay, thank you so much. And then don't forget to share my videos. It's very, very, very important. Share my videos, like, and then encourage others to also subscribe. And if you would want me to do any video for you, if you have any question or any video you probably have no idea about, let's say any health information you are not clear about, and then you need more information on it, you can let me know. I'll make a video on it and then post it to you. Okay, thank you so much for joining me today. I really appreciate you. Bye.